One of the areas of the face that people focus on and frequently like to find a way to change is the cheekbone area. Now, sometimes people have a deficiency of the cheekbone area just as a genetic trait, and there's just not enough fullness and they wish it was larger. The ideal for the cheek area is to have what's called an ogee curve, where there's an outward curve, then an inward curve underneath. And that just is what the cosmetic or aesthetic ideal is for that area. Over time, as we age, that tissue descends down the cheek area and we lose that upper fullness, and it fills in the lower indentation and just creates more of a flattening of the cheek that just makes for a less aesthetically pleasing appearance. There are a number of different ways to improve that. Most of them involve placing something in there to bring back the fullness. Implants are the most common method, and there are a number of different types. The easiest is the silicone implant, where it's just a silicone shape that looks like a cheekbone that's inserted underneath the tissue in a little pocket right above the bone. Those are relatively inexpensive, but they do have some problems with movement and malposition and things. A little more expensive method is to utilize one of the more recent implants, such as the hydroxyapatite implants, which are kind of a bony substance made from coral, or a MEDPOR implant, which is kind of a plastic implant. But it has an expansion with air pockets where tissue can grow in, just like the coral type can, where it becomes a part of your living tissues and therefore doesn't move around or displace as easily. All of those do require a surgical procedure to implant them in next to the bone, and therefore obviously it takes some downtime and takes some recuperation. One newer method is to add in an injectable filler in the cheek. There are a lot of different products on the market for that, but most recently the Voluma has been kind of declared as the one that's specifically for augmentation of the cheek. That's injected in the office without an anesthetic, and it's just put in next to the bone, and it fills out just like the implants do. Now, the injectable fillers are not a permanent answer. They last for about 2 years and then gradually disintegrate as your body absorbs that substance, and have to be repeated to maintain that effect. But it is a nice, minimally invasive method of achieving that appearance.